everyone. Welcome back to Little Brain Campaign. I am your host, Dr. Lauren LaRose. I'm a board certified child and adolescent psychiatrist and adult psychiatrist. And if you are new to this podcast, thank you for joining us. If you've been here for a while, you probably know my story. This podcast was started as a way for me to explore how to help my own patients, but also how to help one of my children. So I'm a mom of three. One of my children has a condition called PANS, and it has been a real journey figuring out how to help him. So I actually had the honor of listening to our guest at a conference in Boston in October of this past year. And she was very gracious to agree to come on today and share her knowledge with us. So I want to introduce Dr. Elisa Song. She is an integrative pediatrician. She is the author of a wonderful book that everyone should go out and get right now. It's called Healthy Kids, Happy Kids. And she is going to let me pick her brain for a little bit today. So thank you for being with us, Dr. Song.
Oh, yeah, no, I'm honored to be here with you.
Okay, so I want to just start by talking about how did you get to where you are today? What was your journey?
I think for many physicians who head into a more integrative or functional medicine route, they have a story, I think, similar to yours, where conventional medicine didn't have all the answers, right? Whether it was for themselves or for a family member. Fortunately or whatever it is, was not my story, right? I actually stumbled upon what was then called alternative medicine,
Mm-hmm.
right? Back when I was an undergraduate at Stanford, and this was back in the um, late 80s, early 90s. So it was quite a while ago.
Mm-hmm.
And I just was fascinated. What is this thing called alternative medicine? And I grew up in a very conventional medical household. My mom was an OBGYN and lots of
Oh,
antibiotic courses, lots of, all the things, right? Very, very conventional. Yet I think that having a Korean background and my grandmother making us herbal teas and all of that, kept us open. And so when I was at Stanford, I saw this flyer for what was called the American Holistic Medical Association.
mm-hmm.
And I thought, well, let me check out what this is. I don't know what this is. And I heard from people that were just so inspirational. So they were just getting known at the time, Dr. Andrew Weil, Dr.
Mm-hmm.
Deepak Chopra, Joan Borisenko. And so it was then that I decided, you know what? I think I could do this. Like, this is the kind of medicine that draws me. And so every step along the way, through medical school, through residency, even though I didn't know exactly what it would look like, that was what was the cornerstone of how eventually I want to practice. And so this is how I practice to this day. When I started my practice in 2004, it was as an integrative functional medicine practice. And the terms have changed. It used to be called alternative medicine, then holistic medicine, and now it's really an integrative approach, because it's not an either or. I mean, you
Right,
definitely don't want to throw out the conventional baby with the bathwater.
right.
There is a time and a place, as you know, for kids with PANS, PANDAS. Oftentimes they need pharmaceuticals to recover, but
Yes,
they also need that functional integrative approach to restore health and optimize health. Really from that inside root cause level, so that we don't continuously need pharmaceuticals.
right, right. So I want to start by talking with you about the gut microbiome, because I know that that's, the real meat and potatoes of your book. So I know we all hear about this a lot, right? Can you
Mhm.
explain exactly what is the gut microbiome?
So the gut microbiome is actually an ecosystem. A lot of people equate the gut microbiome with probiotics, the microbes in your gut. But the microbiome is really that community of microorganisms which comprise bacteria and yeast and viruses and parasites. So the whole conglomerate of microbes and the
Mhm.
ecosystem in which they live and the genes that they bring with them. I mean, their genetic material outnumbers ours. I mean, the numbers, are estimated anywhere from 5 to 1 to 10 to 1.
Right.
And so what they do for us or don't do for us has profound impacts on how our immune system functions, how our brain functions, how our hormones and metabolic health are established. And this is especially true for children, because
Mhm.
children's microbiomes and babies' microbiomes look very different than our microbiomes as adults. And they should. They are designed to, as newborn babies, brand new to this entire world, be our main interface with our outside world, from the
Mhm.
food we eat to, the what we're breathing in, what we're drinking. They communicate and really feel what's going on in our outside world that comes through us, and train your baby's immune system, train their developing brain. So we can see how profound this impact is from some of the studies that look at microbiome disruption early on in life. So
Mhm.
there was a very large study, almost 800,000 children. This is now back in 2015-ish. That looked at babies who received antibiotics or antacid medications in the first 6 months of life. Now, what do they
Right.
have in common? They disrupt the gut microbiome. So antibiotics don't care what bacteria they kill. They can kill all of the beneficial probiotic organisms along with the disruptive organisms.
Mhm.
Antacid medications can do something similar by disrupting the pH balance of your gut and allowing different microorganisms to thrive that wouldn't necessarily. And so that study found that babies who received antibiotics or antacid medications in the first 6 months of life had an increased risk of virtually every single allergic disorder by the time they were 2. And,
Wow.
nearly up to, 50% in some cases. And that includes eczema, asthma, hay fever, that kind of allergic atopic march that we see as pediatricians.
Mhm.
And also hives and anaphylactic food allergies. I mean, as a medical student and as a resident, back um, in the late, I guess it was the early 90s, right? To the
Mhm.
late 90s, we hardly saw kids with anaphylactic food allergies,
Yeah.
right? And it's not
Mhm.
that far from now. I mean, this is
Nope.
maybe 25 years from now. From then, 1 in 13 kids now has anaphylactic, life threatening food allergies.
Wow.
So we need to wake up and realize that that foundation gets set really early on in life, when the gut microbiome for those babies doesn't train their immune system properly. And you're, as a psychiatrist, right? You've seen, just the crisis of mental health that has only gotten worse for our kids. I
Yes.
mean, we
Yep.
were in crisis, decades ago, and it just continues to get worse. And what I want parents and children to understand is the role that their microbiome plays, because a lot of kids, with mental health concerns, maybe they have GI issues. I mean, diarrhea, tummy aches, kind of irritable bowel symptoms are not uncommon, but some of them don't, right? Some of them have
Right.
zero GI symptoms, but what I want them to know is mental health symptoms are gut microbiome symptoms.
Yep.
And there's another study. This is a million birth pairs. It was I believe it was a Finnish study, and looked at babies who had antibiotic exposure early on in life. Now,
Mhm.
that even included when they were inside their mother's womb, mothers who received antibiotics while they were pregnant, and found that antibiotic exposure early on in life could increase the risk of many, many mental health concerns by the time those kids were older
Right.
kids and adults. And the more rounds of antibiotics, the higher the risk. The risk seemed the highest when that exposure was before 6 months of age,
Mhm.
because of the priming that occurs to their developing brain. So it's not that what happened back then is a done deal, though, right? Because I know, I mean, I tell everyone, both of my kids received antibiotics when they were under
Right.
5 weeks of age. They were absolutely necessary. I mean, a little baby, my daughter had a urinary tract infection at two
Right.
weeks of age. My son had strep, and he presented with, um, a perforated eardrum, essentially.
Wow. Mhm.
And so, with strep that was coming out with
Mhm.
pus in his ear, there's no way we wouldn't treat a baby with antibiotics, right? I
Right.
mean, we do not want their infections to become more life threatening. On the other hand, we want to understand the the unintended consequences, sort of
Right.
that cycle that can occur if we don't know to address their gut microbiome. And I was really fortunate. I was already practicing as an integrative pediatrician. Even then, I mean, my kids now are 16, all 16 and 14. And
Mhm.
do I wish I had done things differently? Yeah. I mean, I think as moms, we can't help, right? Like
Yep,
we always
yep,
think,
yep.
God, there should have been why didn't I know now what I know then, right? We will
Yep.
always do that as moms, right? But no matter where you are starting from, if you are a mom of a kid who has anxiety and they're 13 right now, or who has an autoimmune condition like PANS or PANDAS, or
Right.
who has really bad eczema and they're two, just knowing to look at the gut microbiome, you're a leg up that, from so many other parents who don't know yet, and
Yeah.
even so many physicians who don't know yet. And so now, it's time to really learn how to restore your gut microbiome, which we can do at any age. Might be a little bit harder, take a little bit longer, but we can do it.
Right, right. And I think that is such an important message because when we hear, antibiotics in the first 6 months of life, we're going to, put them at a higher risk for all these conditions later in life. I think automatically it's like a little bit of a doomsday feeling like, oh,
Yep. Yep.
there's no hope for my kid now. But that's not the case. That it doesn't matter how old your child is, there is still time to restore their gut microbiome and try to prevent the progression of some of these conditions or maybe prevent them from happening at all or just have a better outcome for them.
Yes. Yeah, absolutely. That is, I love how you phrase that too, because, along the way, I mean, no matter what happened in the past, I mean, your kids are going to face lots of microbiome disruptors as they, get older. And so, no matter what age or stage your child is in, and where they are in their health journey, it's just so important to know. The more we can empower our kids to understand how to live in a microbiome friendly way, create that microbiome, what I call microbiome magic, for
Hmm.
themselves, even as they become older teenagers and young adults, it's going to serve them for the rest of their lives. And it's going to help their children be healthier, who
Right,
are our grandkids, and so on and so on.
right, right. Okay, so besides antibiotics and antacids, what are some common microbiome disruptors that we see in childhood?
Yeah. Unfortunately, when I start talking about this list, it's pretty much everything we're exposed to every day. I mean,
Yeah, yep.
in reality, right? So the first thing that I want to say to parents and kids is the list of microbiome disruptors is not necessarily to have you try to live in a little hygienic bubble, because that's not
Hmm.
healthy either, right?
Right,
In
right.
fact, loneliness is one of the biggest determinants of
Yep,
health, right?
yep.
Physical, immune, neurologic health, right? Not
Hmm.
just our mental health. And so it's just to know, okay, where are the things that we can move the needle, right? Where can we reduce some of our exposures? And because we can't reduce every single exposure, that is the price we pay for having the conveniences of daily life. Um,
Right.
what are the ways that we can build up microbiome resilience so that, even if they are faced with a disruptor, they can, their microbiome and our kids, their health can bounce right back. And I think the things that we have the most control over is really the food that we eat. Right.
Yes.
In my book, I call them microbiome mischief makers in our processed foods. I mean, these are probably
Hmm.
the top things that our kids get exposed to. And, number one is going to be all of those FDA approved food additives that are meant
Uh-huh.
to make our food look better, taste better, give our better mouth feel, make it more addictive, make it last longer on the shelves. I mean, that's really and truly why these chemicals were created. And so, having kids be aware and parents be aware of what these are on the label to avoid them can make a huge difference. I mean, I
Yep.
have had kids with, sensory issues and, just very emotionally reactive behavioral concerns. The second they took out emulsifiers in their food and artificial dyes, I mean, it's not just a matter of weeks or months. It's like days to a
Right.
week behaviors can
Right.
turn around, right?
Yep.
And, emulsifiers are a huge thing that I want people to be aware of, emulsifiers basically keep food together from falling
Uh-huh.
apart. So protein
Mhm.
bars, they don't become a goopy mess. Ice cream doesn't just become a puddle in the tub. And it's not going to say emulsifiers on the label. It's going to say things like carrageenan or xanthan gum or carboxymethylcellulose, CMC. So I have a list of the emulsifiers to look out for. It's not as hard to remember as you think, because once you start looking at labels, your brain immediately just recognizes carboxy. Okay, you don't have to read the rest. If it says
Right.
carboxy, just put it back, right?
Right.
And this is where, I really truly believe that teaching kids how to read food labels, that is one of the most important life skills we can teach them
Yep.
as we prepare them for independent, young adult life.
Right.
And, even for my kids, when we go to the grocery store, which I don't know, how old are your kids right now?
9, 7, and 5.
Okay. So you probably, you're probably fine with your 9-year-old. I don't know. It was many, many years before I really enjoyed taking my kids to the grocery store, because it's like, can I have
Uh-huh.
this? Can I have? And it felt like this exercise and just constantly having to say no and feeling
Yep.
terrible about it. Right.
Uh-huh.
So they are, they're 16 and 14. And yes, sometimes that still happens, but now they know if they want some, like a bag of chips, I'll say, well, you go and pick out a bag of chips that will be, mutually acceptable.
Right.
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 And then they know, okay, they go to the bag of the chip aisle, and then they look at the labels and they know, okay, if it says artificial, they put it back. If it says, any emulsifier on it, they put it back. If it, they know. And now they know in the chip aisle at our local store, which chips are the ones that, they like and the ones that I'm going to be fine with. Right.
Right. Right. Right.
And so that's really important, because we want them to be able to make those food choices on their own. They're out with their friends. I can't call them and say, well, what are you going to get now? Right. I
Right.
could, but that's not the best way to approach that. Right. And so, so that's one in our food. I will say environmental toxins, right? All of these chemicals that are called endocrine disrupting chemicals, our
Mhm.
phthalates, our parabens, our forever chemicals, right? PFASs. It's,
Right.
for children, we can see impacts of these endocrine disrupting chemicals on so much more than their hormones. We
Right.
see neurologic and behavioral harm. We see immune harm. Of course, we see, hormonal harm with earlier delayed puberty, um, ambiguous genitalia. Things like that. But there are so many far reaching impacts besides just on hormones. There was this one article that really has a call to switch the paradigm and call them microbiome disrupting chemicals,
Uh-huh.
because of all of the, ripple effects that they have on your child's developing organ systems, throughout their body. And so, to the extent that we can reduce our use of plastics, which is anyway gonna be so much better for the environment, right?
Right. Right.
Making sure that our skincare, that we use for ourselves and for our kids don't have parabens in them.
Mhm.
Really reducing the exposure to forever chemicals, the nonstick pans, the things. There are things that we can control. Um,
Right.
and can reduce that load. We are never going to get rid of forever chemicals in us.
Yeah.
That's clear. They are forever, right?
Right.
Meaning that it's decades, decades, decades for them to degrade and get eliminated. Microplastics, they're in us, but
Yeah.
can we reduce how much more we get exposed to? Absolutely. And
Yeah.
one of the fascinating things is, part of the reason, these forever chemicals linger so much is because they don't get eliminated really through the normal routes. Like, let's take glyphosate,
Mhm.
Roundup in non-organic foods, or parabens or phthalates. If we reduce our exposure to those, we pee them out so quickly, our body burden goes down. We don't
Uh-huh.
really pee out PFASs. We don't
Yeah.
sweat them out, right? And so there have been several studies that looked at, well, what are different ways that we can actually get rid of them, right? And fiber and a
Mhm.
healthy gut microbiome, certain probiotic strains, still comes back to the gut, but eating more fiber
Yep.
and optimizing your gut microbiome has been shown to lower your PFAS levels, which is fantastic, right?
Yep. Yep.
So that too. Yeah. I mean, that's exactly what my book is about, is just really understanding how optimizing your gut microbiome can help with so many of these things. Now, other microbiome disruptors, well, we mentioned antibiotics and
Mhm.
antacid medications. But here's the reality of it. As more research gets done, we realize there's so many other medications that have
Mhm.
microbiome disrupting effects nearly as much or as much as antibiotics.
Yep.
So these are things like, I mean, very common medications, antihistamines like Claritin or Zyrtec, right?
Mhm.
Um, SSRI,
Yep.
antidepressant, anti-anxiety medications,
Mhm.
right? Steroids, all of these medicines that, when we think about the crisis of adolescent anxiety in our
Yep.
girls, right? And our
Yep.
boys, right? It just manifests a little bit differently, right?
Mhm.
But, if we're looking at that, how many of our teenagers, our teenage girls are on low dose antibiotics for their acne, right?
Mhm.
They're on birth control pills for their horrible period cramps,
Yep.
and they're on an SSRI because they
Mhm.
have anxiety. And so maybe each of these three individually at first help them,
Right.
but eventually, either they don't help or they stop helping,
Right.
right?
Right.
And so then we have to think, before we think about switching meds or adding on other meds, why not optimize their gut microbiome, which will then improve their gut hormone relationship so that their periods aren't as bad. The skin gut connection is essential for healthy skin. And
Yep.
of course, neurotransmitters. I mean, 90% of our serotonin is made in our gut. And, what's really interesting is I know it's not conventional at all to check blood serum serotonin levels,
Uh-huh.
right? However, I follow them. And what I have noticed is that for my kids who are placed on SSRIs, that over time their serum serotonin levels seem to decline, and
Yeah.
they will often drop to unmeasurable levels. Now, we
Wow.
know, we don't know that serum serotonin levels really correlate with brain levels. However, if you have no serotonin floating around in your blood, it would just make sense that there's probably not optimal levels in your brain. And
Right.
where does most of that come from? Most of that is coming from your gut.
Right.
And so it still becomes a gut microbiome issue.
Well, and serotonin has other purposes other than just brain,
For
mental
sure.
health, right? So it has other functions elsewhere in your body. So you still need it in the rest of your body.
Absolutely.
So,
And think about your gut. I mean, your gut needs that serotonin too to
mhm.
be to function appropriately. I mean, irritable
Mhm.
bowel syndrome, IBS, which can be really um pretty disruptive to
Yes.
kids and adults' lives. Yes, we see it in kids and adults who have depression and anxiety, but serotonin is one of the underlying factors.
Mhm.
There are, like with IBS, some patients are prescribed SSRI medications, and it works. It doesn't mean that it's just a psychological problem that's in their heads. It means that serotonin has far-reaching effects,
Right.
gut and brain.
Right. Right. Um while we're on the mental health, conversation, I wanted to talk about the vagus nerve. Um because I think this is another thing that we hear a lot, but I don't know how much people really understand about what is the vagus nerve and what's its function in the body. Can you
Yeah.
explain about that?
So some people now have heard of the vagus nerve, and they've heard that maybe um, they might have heard of something called heart rate variability or
Mhm.
HRV.
Mhm.
It's something that if you have an Apple Watch, you can track it. If you have an Aura ring, like I do, it tracks it. There's more and more awareness of this thing called heart rate variability that is a really good marker for our current and future health. Right.
Right.
Now, heart rate variability is a proxy. It's a way to indirectly measure how well your vagus nerve is functioning.
Mhm.
And your vagus nerve is part of your nervous system called your autonomic nervous system. And some people call it your automatic nervous system because
Mhm.
we don't really have control over it. And
Right.
there's two main branches. We have our sympathetic nervous system, which a lot of people are familiar with, that fight or flight response. That's your sympathetic. It is not bad outright by itself. Okay, this is
Right.
very important, right? When
Mhm.
you are crossing the street and a car comes whizzing by, you bet you want your sympathetic nervous system to kick in. So
Yep.
your muscles contract, your heart rate's up, and you can jump right back, right?
Mhm.
I mean, that's your sympathetic nervous system doing what it is supposed to, right?
Right.
In,
Yep.
the proverbial caveman days or cavewoman days, it's like, do you run or flee from, run or fight the saber-toothed tiger, right?
Right. Right.
Um, so that is a normal, healthy response. When we get sick, we want our sympathetic nervous system to kick in
Right.
because that is another thing that we are, quote, fighting, right? The
Mhm.
problem in our modern world is that our sympathetic nervous system is just turned on pretty much all the time,
Yep.
right? From, getting your kids to school and they're running late and they're screaming and they don't want breakfast and all the things where you're like, oh, uh, and then you have a deadline that's late, or for kids, it's, they got an awful text and, it's all these things, right?
Yep.
So there's constantly things that trigger this fight or flight response. The parasympathetic nervous system, which is ruled largely by the vagus nerve,
Mhm.
is the counterpart to our sympathetic nervous system. When we've jumped back onto the curb after a car comes whizzing by, we don't need to be, in that fight or flight, jittery heart rate beating state. We can, take that
Right.
deep sigh, reset, and then move on and be more calm. That's your vagus nerve that said, okay, let's kick in. Sympathetic, you've done your job. Now I'm taking over. We're going to get back into, a more calm state. Right.
Right.
And the parasympathetic nervous system is what some people call the rest, digest, restore state, where
Mhm.
um, we are in that state where we can optimally digest our food, where we can get into a calm, deeper relaxation state that some people might call meditation, right?
Right.
Um,
Right.
and so um, that again, largely ruled by the vagus nerve. The vagus nerve starts in your brain and it wanders all through your body. It's
Mhm.
actually, the term vagus is from the Latin root for vagabond or wandering, right?
Didn't know that.
So yeah, it's the longest nerve in our body. And if you
Mhm.
look at diagrams, it comes out from your brain, wanders through your body, and there's branches that come out and touch almost every organ.
Mhm.
That alone should show you how important it
Yep.
is,
Yep.
right?
Yep.
And your vagus nerve will do the opposite. It helps your heart rate slow down a little bit. It
Mhm.
helps your pupils get back into a normal state. Now, it doesn't just slow your heart rate down though. It allows it to be variable in a
Right.
healthy, normal way, right?
Mhm.
So in a healthy, calm, restored moment, like you and I talking right now, if I had you feel your pulse, right, on the side of your neck, and I have kids do this too, just find
Mhm.
this. And I do this when I'm listening to their hearts with my stethoscope.
Right.
I'm not just listening to see, do they have a heart murmur? I'm listening to the speed. And then I have them to, and let's say you have your heart rate like this. And then I have them take a deep, slow breath in. Heart rate should speed up. And then as they exhale slowly, it should slow down.
Right.
It should vary with your breath, right? Now,
Mhm.
that heart rate variability, again, it's been found to be one of the best predictors for current and future health. And
Yep.
so now, on purpose, we need to really work on engaging our vagus nerve. And so that's the second piece. I mentioned that, reading food labels to me is one of the most important life skills that we can send our kids off, into adulthood with. The second, and it's not, it's not a comparison. They're both equally important, right? The food
Yes.
labels, and then also learning how to regulate their nervous system
Yep.
when they get anxious for a text, or when they see something really mean on social media, or if their friend has just shoved them, right, and they're kind of you know learning how to slow down that breath, get back into a more calm state before they act is really important.
Yep.
And um the thing with the vagus nerve and the parasympathetic nervous system, I said that it's automatic, except, like, if you're sitting here, you can't will your heart rate to go up. I can't sit there and say your heart rate go up or heart rate go down, right?
Right.
However, your breath,
Mhm.
I can slow down my breath, and that slows down your heart rate.
Yep.
That lets your pupils, go back to normal size. That helps regulate your body temperature. And we can control our breath, which is why learning how to take those deep belly, diaphragmatic breaths, doing breath work exercises, that's one of the most effective ways that we actually have to control our vagus nerve, our parasympathetic nervous system, get ourselves out of fight or flight, and regulate our nervous systems. And it's why the chapter of my book on the vagus nerve is called Breathe, because that is one
Mhm.
of the first things I want kids to learn how to do when they're getting, when they're getting worked up, right?
Right.
Or having anxious feelings or uncomfortable feelings.
Mhm.
Instead of before doing anything, just slow your breath, 5 deep breaths, and then you can usually after that, you can see a little more clearly what should you do, what should you not do,
Right,
right?
right,
In
exactly.
that moment.
Yeah, because when you're in the fight or flight mode, that sympathetic mode in general, your brain is thinking about survival and
Mhm.
protecting itself, and it's often not thinking in the most rational, logical way about all the possible outcomes of
Yep.
the scenario you're in.
Absolutely. I mean, we as adults would be, wise to really practice this every day too, right?
Yes. Yes, yes, I know. I need to remind myself that, I think as moms and professionals, I think unfortunately we can get stuck in that sympathetic mood frequently.
For sure,
And
for
you
sure.
do have to be really intentional about recognizing it and breathing your way out of it.
Yeah. And, I will say it is always a work in progress, right? You are
Yes.
always gonna have moments where you're like, "Oh my god, I just lost it," and, like, I
Yep.
really regret that, or, and maybe it's with your kids or in front of your kids, right? It's
Mhm.
not so much that you never do that.
Yep.
Once you learn how to engage your vagus nerve, that emotional reactivity will be less. I mean, you
Right.
won't kind of like, "Ah," to everything,
Mhm.
right?
Mhm.
On the other hand, there are moments where that happens, right? It's a part of life.
Yep.
And the most important thing is how you respond then, right?
Exactly.
Afterwards. Like, wow, mom was really upset and, angry about this. And this is how I responded. So you're kind of narrating like what just happened, right? Because sometimes
Yeah.
your kids are like, oh, like what's going on with mommy, right? So you're kind of narrating, explaining what happened, and then say, you know what? I'm gonna calm, take my
Mhm.
5 breaths, and then
Yep.
we're gonna talk about, what I would do the next time, right? So you're just
Yep.
modeling that.
Exactly. It's all about the repair. It's all about the
Mhm.
repair.
Yeah.
I want to really quickly, before we end, talk about, since this is near and dear to my heart, gut microbiome, vagus nerve, and pans and pandas. Like, how
Yeah.
are these all connected?
Yeah. So, I mean, your listeners are familiar with PANS and PANDAS, but
Yes.
for folks who are listening for the first time too, PANS stands for pediatric acute neuropsychiatric syndromes. It is when a child has, a more or less sudden onset of neuropsychiatric symptoms that can include, you know. Severe anxiety, OCD, tics, eating restrictions, behavioral regressions, handwriting regressions, there's often, food restrictions and urinary issues. So a whole gamut of symptoms and can be triggered by infections like Lyme disease, Epstein Barr, herpes 6, I've seen,
Mhm.
influenza, I've seen, and strep. And when it's caused by the strep bacteria, we call it PANDAS. It can
Mhm.
also be caused or triggered by non-infectious etiologies like
Yep.
mold toxins, mycotoxins can
Mhm.
be a factor, and sometimes there's multiple factors, right?
Yep.
But it is an autoimmune reaction to some exposure that then triggers these antibodies to be created that start to target different parts of the brain that are
Right.
associated with emotions and connectivity and processing, which is why we see this whole array of different symptoms. And the symptoms
Right.
can be different for different kids, right? But it is an autoimmune encephalitis, which means brain
Mhm.
inflammation. And autoimmunity, when we think about it, doesn't just happen overnight. Now, if you are a
Mhm.
mama of a kids with PANS or PANDAS, it can seem like, overnight, they became a different kid, right? So that is what we see. What we don't see necessarily is, those months or years even of sort of that backstory building of the immune system just
Yep.
shifting a bit so that then when it faces an infection like strep, instead of just getting the sore throat, you take antibiotics, you're done, you get the strep in your throat and that triggers all of these different reactions, right?
Yep. Yep.
So it's an abnormal immune regulation and immune response. And autoimmunity largely stems from the gut.
Right.
What we do know from an autoimmune perspective is that there can be many different microbes in the gut that are abnormal, that are linked with autoimmune reactivity and increased autoimmune risk. And in
Mhm.
particular, it's this category of bacteria that are gram-negative bacteria, right? There's a
Mhm.
whole class called Enterobacteriaceae. Now, listeners may have heard of E. coli.
Yep.
Um, maybe or maybe not, they've heard of Klebsiella or Citrobacter. These are
Mhm.
common bacteria in that family, that releases a certain toxin that can trigger autoimmunity and also can trigger neuropsychiatric symptoms. And so
Mhm.
I have had kids, go into remission from their autoimmune diseases, not just pandas, by getting rid of that Klebsiella or
Yep.
Citrobacter. So,
Yep.
so part of a PANS protocol is optimizing the gut microbiome. But then there's so much more. The immune system is dysregulated. There's inflammation going on. I mean, we have to, really manage that. And there are many different facets, and they might include things like um, uh, prescriptions, like antibiotics,
Mhm.
sometimes even steroids. They can, for me, absolutely include, supplements and herbs like specialized pro-resolving mediators, your SPMs, or derivative of fish oil, curcumin, low-dose naltrexone, um, a variety of different plans that really look at the root underlying clinical imbalances that are going on. But when we think about inflammation and the resolution of inflammation is driven by our vagus nerve. Our
Mhm.
vagus nerve controls this really important inflammatory pathway, which is why during COVID, actually, there were some studies looking at vagus nerve stimulation in ICUs to
Mhm.
reduce the risks of sepsis, cytokine storm, all the phrases that we've become all too familiar with, right?
Right.
As lay people, with these
Mhm.
infections.
Mhm.
And so the vagus nerve is essential for proper immune functioning. And with PANDAS and PANS, the immune system, yes, it's creating too much inflammation on the one hand, but it's also not regulating that inflammation. So it's a
Right.
it's a two-pronged piece, right? Or
Mhm.
multi-pronged piece, I should say. And we want this regulation part. We want your immune system to react normally, right?
Right.
We don't just want to
Right.
squash inflammation. We want to know that when inflammation happens again, that the part of your immune system that's supposed to keep it under control and get rid of it when it's not necessary is acting appropriately. And that's what your vagus nerve does. So
Right.
vagus nerve work is essential for um, like ultimate healing
Mhm.
from PANS, PANDAS, and I would say any chronic condition that you're working with,
Yep.
even from eczema, right? We know, kids with eczema or asthma, their flares can be triggered by stress,
Yep.
right? And so how do we, kind of, unravel that, right?
Mhm.
And so for kids with PANS or PANDAS, though, when they're in the height of a flare, just like we were talking before, when you're in that stress, fight or flight state, your brain just can't access the tools that maybe are even in there, right? The breath work, the meditation, the whatever. I mean, you're just like, I'm not doing that. I can't, like, forget it. Right? I'm too stressed. And so there are some, passive ways to help regulate your nervous system, stimulate your vagus nerve. And I do use those devices in my practice because
Yep.
it's kind of a, replace instead of, the ice face and an ice bucket of water, right?
Mhm. Mhm.
Which I mean, most kids are going to like to do. You can use a device, right?
Yep.
So I use something called an Apollo Neuro wristband, right? That
Uh-huh.
can stimulate. I mean, I'm wearing one right now, that just has different vibro acoustic frequencies that can help um, optimize vagus nerve tone. And then there's other devices that aren't approved for kids, but under my direction, I will work with patients to use them. Like I mean, there's one called the True Vega, that
Hmm.
that I've used. There's another one that I'm trying out. Completely can't remember the name of it right now. But yeah, the more that we can help your kids' vagus nerve, and this is also really important for parents. Um, and I'm gonna say, especially for the mothers or the
Yeah.
the primary caregiver, which is, I mean, typically when it comes to health, it's the mother, right? I mean,
Yeah.
let's
Yep.
just face it, 99% of the time in a household, it's the mom who's making the doctor's appointments, who's up all night, Googling for answers. And
Yep.
maybe now they're using ChatGPT, right? And they're it's like on their minds 24/7. What can I
Yep.
do to help my kid? What's the newest thing? Is there something else I haven't tried? Right? Which doctor can I reach out to? So there's a
Hmm.
huge mental load there that that we also want to be aware of. And, I think that the vagus nerve work is really, really important for moms too.
Yep.
Whether you're a mom of a kid with PANS or PANDAS or any other chronic health concern, maybe your child has autism or, anxiety or something else going on, right? Because I have seen kids where um, they're they're good, right? I mean, we go through the
Hmm.
work and they do great, and, they stop flaring and they're, quote, "in remission." But then, moms are still holding their breath. They're
Yes.
still like they're just waiting for the next shoe to drop, and you can
Yep.
tell they're still like, I have this one mom, her son now has been doing well for, I don't know, maybe 5, 6 years,
Hmm.
and it was only this past year where she came in and I noticed, okay, her shoulders are down a little bit.
Hmm.
She's not speaking as quickly. Her eyes aren't darting as much. Like she's like more able to be in that kind of safe, trusting space,
Yep.
right? Which I get is so hard to do when you've had a sick kid. Um,
Yes.
but but it is essential to do, so
Yes.
that you can both heal together.
Absolutely. Absolutely. So I think that's a great message to end on. Moms, please go take care of yourself. I'm working on
Yes,
it
please.
too. It's a, it's a work in
Yes.
progress. But Dr. Song, thank you so much for being here. Can you please tell everyone how to find you?
Yeah, the best place to find me is on my website. That's healthykidshappykids.com. You can find me on Instagram is where I'm most active. That's healthykids_happy kids. And you can find my book, which is also called Healthy Kids, Happy Kids. Pretty much anywhere books are sold. I mean, please support your local bookstores if you can. But of course, Amazon and Barnes and Noble and all the major outlets.
Okay, great. Well, thank you. I appreciate it. And thanks everybody for listening. Thank you for tuning in to this episode of the Little Brain Campaign podcast. If you've been enjoying our show, give us a follow on your favorite podcast platform so you never miss an episode. If you know someone else who would enjoy this conversation, please take a minute to share this episode with them and help grow our audience. See you next time.